So I forgot to mention chemotherapy-induced menopause because that's also awful. So I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years, and I've been talking about how when your hormones change and you go through perimenopause and menopause, it affects your pain, your joint pain, your muscles, your bones. And this commenter, I haven't been talking about this. I know this. I see this and treat this in my clinic. Chemotherapy, let me show you some research. Specifically, what she's talking about is you're going to be, if you have breast cancer, placed on an aromatase inhibitor. What that does is blocks your estrogen, aka like menopause. And the joint pain is awful. Ask any of your friends that have been on one of those inhibitors that blocks the estrogen for their breast cancer. If 1 in 8 women get breast cancer, you guys know a lot of people. Their joint pain is horrible. Now, as a physical therapist, I see women who are post-breast cancer for a variety of reasons. Their widespread joint pain, their range of motion, but we know that exercise actually reduces joint pain, and this is why I am talking about this as a physical therapist. Now, this is referencing an old article from 2014, but this particular reference states a new study, 10 years old, not new, found that exercise eases joint pain. That's a common side effect of aromatase inhibitors, which means blocking estrogen. So when you hear me talking about women who have perimenopause and menopause and widespread joint pain, and people are like, are you sure? Yes. Estrogen brokers inflammation and helps you not feel like garbage. If you don't need any other proof than when your best girlfriend got breast cancer and had to be put on a medication to block her estrogen and then she had pain. So these hormonal medications work because they lower the amount of estrogen in the body and they block the action of estrogen on breast cancer cells. If you are wondering what the name of that medication that your girlfriend might be on or you might be on, oftentimes it's Tamoxifen. So Tamoxifen is helping women have the estrogen receptors blocked because they're trying to make sure that the cancer doesn't come back. But because of that, there is a 50% chance that whoever gets placed on that med will have significant arthritic joint pain along with this, which is in essence a chemotherapy-based menopause. And it might not show up for about 2 months and it becomes the worst at 6 months. Please remember this when you are going through perimenopause, menopause, or if you have breast cancer, that this is why you have this joint pain. So aromatase inhibitors cause joint pain and stiffness because these are the most common side effects. Doctor will call these pains arthralgias because it mimics arthritic pain, and up to 50% of women taking an aromatase inhibitor such as tamoxifen, will have joint pain or stiffness. Less common but more severe side effects of these medications include heart problems, osteoporosis, and broken bones. If you have been following me on this channel, what does that sound like to you? Menopause. Because you block the estrogen and this is what happens. So thank you for asking me to talk about chemotherapy-based menopause and joint pain because you are right. And so now you're going to get a couple more posts about this. Hit the plus sign and follow for more women's health and wellness tips. Bye.